Pathophysiology of congestive heart failure or CHF. Congestive heart failure (CHF) is a complex condition where the heart muscle is unable to pump blood effectively. This can lead to fluid buildup in the lungs and other tissues. There is underlying mechanisms of CHF can be categorized into two types, which is systolic heart failure and diastolic heart failure. In systolic heart failure, impaired contractility, the heart muscles weakens, reducing its ability to pump blood out of heart, and also reduced ejection fraction, less blood ejection from the heart with each contraction, and increase afterload. The heart has to work harder to pump blood against increased resistance in the blood vessels. In diastolic heart failure, impaired relaxation, the heart muscles stiffens, making it harder for the heart to fill with blood. Reduce filling time, less time for the heart to fill with blood, and also increased preload pressure in the heart chambers. Compensatory mechanisms is response to reduce cardiac output. The body activates several compensatory mechanism, neurohormonal neurohormonal activation, the sympathetic nervous system, and renin-angiotensin aldosterone system or RAAS are activated, leading to increased heart rate, vasoconstriction, and sodium and water retention. For ventricular remodeling, the muscle undergoes structural changes, including hypertrophy and fibrosis, in an attempt to compensate for reduced function. Progression of CHF. Over time, this compensatory mechanism can become a maladaptive, leading to further deterioration of heart function and worsening symptoms. And for clinical manifestation, shortness of breath. Next is fatigue, fluid retention, rapid or irregular heartbeat, cough, especially at night, and also reduced appetite, confusion. And for the treatments, treatments of CHF aims to alleviate symptoms, improve heart function, and prevent complications. This involve medication, lifestyle modification, cardiac procedures, and device therapy such as implantable cardioverter, defibrillators, ICDs, and cardiac resynchronization therapy or CRT. By understanding the underlying pathophysiology of congestive heart failure, healthcare providers can develop effective treatment strategies to improve the quality of life and prognosis for patients with this condition. Next, for managing a patient with congestive heart failure, CHF requires a multifaceted approach focusing on reducing symptoms, improving cardiac functions, and preventing complications. First is assess and monitoring. Monitor vital signs regularly, check blood pressure, heart rate, and respiratory rate, because CHF can cause fluid retention and increase workload on the heart. So these parameters need frequent monitoring. Next is assess for signs of fluid retention. Monitor for edema and weight gain more than 2 to 3 pounds in a day, and also assess oxygen saturation, oxygen level. Monitor oxygen level as patients with CHF may develop hypoxemia due to fluid in the lungs. Heart and lung sounds. Auscultate lung sounds for crackles or wheezes, indicative of pulmonary congestion, and also assess for murmurs or S3 sounds, indicate of fluid overload. For fluid and electrolyte management, monitor fluid balance, carefully tracking intake and output of CHF. Patients often need fluid restriction and their fluid intake should be limited to prevent overload. Also administer diuretics as prescribes. Diuretics such as furosemide help removes excess fluid from the body, reducing edema and pulmonary congestion. Next is monitor for electrolytes. Diuretics can lead to electrolyte imbalances, particularly hypokalemia or hyponatremia. So monitor potassium and sodium and renal function. And also weigh the patient daily. Next is oxygen therapy. Administer oxygen as needed. Oxygen may be needed to maintain adequate oxygen saturation level, especially if there is respiratory distress or low in SpO2. Monitor for respiratory distress. Watch for signs and worsening pulmonary edema, shortness of breath, orthopnea or paroxysmal nocturnal dyspnea, which require immediate interventions. For medication, administer medication as ordered. These include ACE inhibitors, beta blockers, and aldosterone antagonists, and vasodilators to reduce preload and afterload. And also educate the patient on medication adherence and emphasize the importance of taking medication as prescribed and potential side effects to watch. For example, a dizziness with beta blockers and a hypokalemia with ACE inhibitors. Next is nutritional support and education. Encourage for low sodium diet. Low sodium causes fluid retention, which can exacerbate CHF symptoms, with a dietitian to help the patient understand how to reduce sodium intake, and also educate the patient on fluid restriction. If prescribed, the patient should limit fluid intake to prevent further fluid overload, and also promote a small frequent of meals. Next is activity and mobility. Promote rest with activity gradation. Encourage the patient to balance rest and activity. Next is encourage mobility as tolerated. If mild physical activity such as short walks may improve circulation and reduce the risk of complications for immobility. Next is patient education. Teach symptoms of worsening heart failure. Instruct the patient and family to recognize early signs of worsening. For example, worsening of CHF. For example, increased shortness of breath, fatigue, weight gain, and swelling and dizziness. Encourage smoking cessation and alcohol moderation. Both smoking and alcohol use can worsen CHF. So, mas mabuti na pong pagbawalan natin sila doon. And also, teach self-care strategies include daily weight monitoring, dietary adjustments for low sodium, fluid restrictions, and an adherence to medications. For psychosocial support, provide emotional support. CHF can be a chronic and debilitating condition. Offer counseling and support to reduce anxiety and help with coping strategies, and also involve the family in care. Educating the patient's family about CHF management can improve adherence and ensure system in is in place. And also next is prevent complications, prevent infection. CHF patients, especially those with advanced diet, may be at risk for infections. Practice good hygiene and consider vaccinations like flu vaccine and also for pneumonia. Monitor renal function. Some CHF treatments can affect kidney function. Regularly assess regular function and adjust medication as needed. By addressing this primary intervention, nurses can help manage symptoms and improve patient outcomes and reduce hospital readmission associated with congestive heart failure.